Slide sheets, sometimes called slippery Sams, can be used to move someone in bed. This video shows how to move someone up the bed and across the bed. A slide sheet works by reducing friction, and 2 layers are needed for the sliding to occur between them. We've used 2 colours to illustrate this in this video. When moving the person, grasp the top layer. When removing the slide sheet, grasp the bottom layer. Ideally, 2 people are required to assist a person who is not able to move very much. If only one person is available to help, this technique can be modified, and we will show you how this is done at the end of the video. When pulling on the slide sheet, brace your tummy muscles and use your legs and body weight to apply a pull to the top sheet to move the person. If you are using an adjustable bed, start by setting the bed height to be level with your knuckles. If you can't adjust the bed, you will need to squat to lower yourself to have your knuckles at the bed height in order to protect your back. Putting the slide sheet into place. Prepare the person for being rolled by raising the knee on the side that will be on top and folding the arms. Use the knee and shoulder to roll the person whilst the other person helping you inserts the slide sheet. Layer the 2 slide sheets and insert lengthways, scrunching both to approximately the middle from the side closest to the person. Ideally, these will be long enough to go from head to foot for someone who is unable to help, but should be at least from neck to buttocks for someone more able. Roll them back and slightly to the other side, spreading out the slide sheet. If the person you're caring for is more mobile, they may be able to help with this. If they were in pain or difficult to roll for some reason, moving the arm across the body and the knee up, the slide sheet can be pushed under the body with a downward motion with minimal rolling required. Moving up the bed. Before moving the person, cross their arms across their body and encourage them to bend their knees if they are able. And at the time of moving, ask them to look towards their toes. This all reduces the amount of work and makes it more comfortable for them. To slide the person up the bed, grasp the top layer of the slide sheet close to the person's body and with your arms tucked close to your waist. Stand with your legs in a wide stance at around the person's hip and shoulder level. The slide involves keeping your arms stable and transferring your weight from the lower leg to the upper leg. It's important that both people assisting work together. We suggest you say something like ready, brace, slide to ensure you are both moving at the same time. Be careful not to slide too far. Sometimes placing a pillow at the headboard is a good idea to prevent injury. The slide sheet does not stay under the person as they will continue to slide. It's important to remove the slide sheet. We do this under the small of the back and move it on itself by feeding it under. Pull the slide sheet towards the small of the back on an angle and it comes out easily without moving the person. If it gets stuck, you may not be folding it under itself. Rolling a person from one side to the other. Insert the slide sheet in the same way as earlier, or if the person is already on this side, lay the scrunched sheet along their back and roll them onto it, unravelling on the other side. The person will then be close to one side of the bed and needs to be moved across and turned. This happens in one movement as shown. Grasp the top layer of the slide sheet on the pulling side, and if someone is assisting on the other side, they can push at the hip and shoulder to assist. With one foot in front of the other and elbows tucked in, pull using your weight from the front foot to the back. Then step forward. This finishes the roll. Any tweaks in position can occur while the sheets are in place. The shoulder can be moved forward for comfort, and you can move someone up the bed using the previously demonstrated technique. Removing the slide sheet under the waist and pulling it under itself avoids any drag on the skin and from accidentally changing the position. using a slide sheet alone. For working with more able people, and when working alone, have a folded slide sheet with the fold at the tailbone and the open end at the back of the head. Support the person's feet on the bed with the knees bent up. Encourage them to tuck their chin to their chest and push through the heels. They slide themselves up the bed. To remove this slide sheet, use the same technique or ask them to roll themselves side to side.